Hi, my name is Summer Park, and I'm currently an advanced practice nurse working in a family medicine department. Today, I'm going to talk to you about my teaching plan project looking at diabetic retinopathy. So for the needs assessment, just looking at diabetic retinopathy, currently there are 25.8 million Americans that have diabetes, costing the United States $245 billion each year. 7.7 million of those individuals have diabetic retinopathy, costing an additional $500 million. On average, only half of patients with diabetes receive their annual eye examination, resulting in diabetic retinopathy being the leading cause of new cases of blindness in the United States. Estimates state that from 2010 to 2050, the number of Americans with diabetic retinopathy is expected to double. In primary care, diabetic retinopathy is becoming a hotter topic because of the new Accountable Care Organization reimbursement targets. Diabetic annual eye exams is a marker for your own personal clinic's reimbursement rate. So money talks. So for our teaching project, the learners are going to be my own staff and team that I work alongside every single day. They're aged between 24 and 63. Our office happens to be all female staff, and race spread is diverse. Most of my coworkers have a minimum of some college education, as they are required to have their CNA license to work here, and they are all English speaking. So the overarching goal for the project is goal of the training is to increase the staff members' knowledge of diabetic retinopathy and increase their confidence in providing education about diabetic retinopathy to type 2 diabetes patients in a primary care office setting. Objective number 1, by the end of the training session, the participants will identify the definition of diabetic retinopathy with a score of 100% on a post-test. Objective number 2, by the end of the training sessions, the participants will identify 2 risk factors associated with diabetic retinopathy and 2 prevention techniques to avoid diabetic retinopathy with an 80% score on a post-test. Objective number 3, by the end of the training sessions, the participants will identify 1 symptom of diabetic retinopathy with a score of 80% on a post-test. And objective number 4, by the end of the training session, the participants will identify type 2 patients who are eligible for an annual ocular exam with a score of 80% on a post-test. So for this teaching project, the method of instruction that will be used is both lecture PowerPoint and a group discussion. So the lecture PowerPoint is looking at the cognitive domain. This has been found to be efficient and cost-effective. It's useful to identify main ideas and summarize large themes or concepts. And it provides a good foundation as a basis for further deepening of learning through something like group discussion. The second method of instruction will be group discussion, or the affective domain. Here, learners will exchange information, feelings, and opinions, and this is found to be an effective method for staff development. So when looking at PowerPoint, I went ahead and did a literature review of PowerPoint. We looked at several articles and studies. The first study that I want to talk about did an experiment where they pilot tested an educational intervention using a PowerPoint online module with a 4-hour workshop to teach internal medicine interns skills in discussing goals of care and treatment decisions with families of critically ill patients using a shared decision-making framework. The findings indicated a significant statistical improvement in comfort level with ICU communication skills following a brief PowerPoint intervention design. The second article looked at an experiment where 1 semester of students received PowerPoint lecture format with text in bulletproof and figures and graphs. The comparison group was students who completed the next semester using the PowerPoint. However, there was no bulleted text and only graphs and figures. The findings found that the students performed better on the last multiple choice test in the course when the text was taken out of the PowerPoint, as well as the students rated the course with no text in the PowerPoint higher on the end of course evaluations. All this to say is the authors of the article stated that instructors should not feel bound to fill the slides with excessive or ample amount of verbiage. The third article was looking at an experiment where half the lectures presented to 2 introductory psychology courses taught in a traditional lecture format, and then the other half were used also used lecture and PowerPoint multimedia. The students had more positive attitudes about the course and greater self-efficacy when they saw the material in the PowerPoint. The fourth article reviewed looked at an experiment where they talked about prostate cancer screening decision aid was developed and then used in educational intervention. The educational material was presented in PowerPoint with a 4-minute video to African American men. They had a pre and a post educational knowledge questionnaire that was given. The intervention given through PowerPoint was successful in increasing knowledge and awareness of personal risks of prostate cancer to African American men. And the last article that I wanted to look at was a 6-week educational session that was given through PowerPoint lecture design to increase knowledge and sensory processing disorders to parents with kids with the SPD. The conclusion found in a pre and post test assessment that the group classroom instruction utilizing PowerPoint design was an effective way of increasing caregivers' sensory processing disorders, overall knowledge, and confidence. So for the summary of the literature review, it was found that the PowerPoint method of instruction is effective in various levels of educational background, race, time increments, and presentation style. PowerPoint can be utilized and effective in material that have greater longevity as well as short time increments. It's an economical method of educating participants in small and large group settings. The target audience is varied in educational background, race, and age. Using PowerPoint has been found to be effective for a wide target audience. Because of the environment, the PowerPoint presentation is also economical and will be easily presented on a projector screen. So for this teaching module, the learning theory integration that we looked at was the caring framework as well as the passion-centered framework. To review, the caring framework looks at excellence in teaching scholarship, excellence in teaching practice, and excellence in teaching leadership. The passion-centered framework looks at passion for caring, passion for trust, passion for collaboration, passion for commitment, and passion for achievement. So lecture in PowerPoint format allows for evidence-based research to be communicated to the students. Evidence-based education is rooted in the teaching scholarship, teaching leadership, and a passion for commitment by the educator. Lecture allows for the instructor to share personal life stories and experiences, which is part of a passion for commitment, passion for trust, and excellence in teaching leadership. And finally, group discussion allows for excellence in teaching leadership, a passion for trust, a passion for collaboration, and a passion for caring. So appropriateness for the learners. For this teaching project, we have a varied learner demographics, age, race, and educational status. We have a use of multiple methods of educational domains, both cognitive and affective. We have PowerPoint handouts that can provide means of re-education and review. We have personal stories to communicate an instructor's enthusiasm for the content. And we have a small group discussion that allows for social interaction and effective learning. So to look at the teaching content outline, to start with objective number 1, we're going to begin prior to the instruction with a diabetic retinopathy knowledge quiz. This is a pre-test. This will be done to compare with the post-test at how effective the educational material was. We will go through objective 1 by defining diabetic retinopathy. This will be done through PowerPoint. It will last hopefully around 5 minutes, and the students will be given handouts. The second objective will be looking at identifying risk factors associated with diabetic retinopathy as well as prevention measures. This again will be a lecture and a PowerPoint, and the resources used for this will be handouts. The third objective will be looking at signs and symptoms of diabetic retinopathy. Again, this will be a continued PowerPoint lecture format, and the resources will be handouts. The last objective will be talking about prevention screening for diabetic retinopathy. This will be done in a lecture PowerPoint, and then I will have a split up into a group discussion. This is more for just talking about personal experiences with patients that might have had diabetic retinopathy, how to schedule eye appointments in our office, and how to go about making eye exam referrals as a team. Finally, we will end with the diabetic retinopathy knowledge quiz being given again as a post-test to compare with the pre-test and how effective the teaching material was. This moves into the evaluation. This is the pre-test and the post-test. A pre-test helps to identify the knowledge levels of the learners and allows for educator to avoid repetition. A post-test is useful in comparison to the pre-test outcomes following instruction. Here are 5 examples of possible multiple choice questions that can be used on our post-test. These are additional resources that can be found to talk about diabetic retinopathy, American Diabetes Association, the CDC, and the National Eye Institute. Here are all the references that I used throughout my PowerPoint presentation. Thank you so much for your time, and I hope you enjoyed the presentation. Now, if I can just figure out how to shut it off. I can't. So sorry. There we go. Stop. Stop. Sorry about that.